We've seen time and time again with the coronavirus that people in perfect health can end up in big trouble. But what if you already have pre-existing health challenges? Joining us to talk about some of those challenges patients with multiple sclerosis face is Dr. Derek Smith. He's a neurologist at the Multiple Sclerosis Center at the Hartford Healthcare Neuroscience Institute. Thank you so much, Dr. Smith, for joining us today.
My pleasure. Thank you.
So first off, I wanted to see if you can tell us a little bit about the multiple sclerosis program and treatment at Hartford Healthcare.
So we're in a very exciting phase. We've been growing quickly. It seems like we're hiring new people almost every month in terms of providers. And our vision is to build an MS program that is close to people with MS so that they don't have to travel long distances. When I first started in MS, which is a while ago now, people had to travel sometimes hundreds of miles to find providers. And we're doing state-of-the-art comprehensive care in multiple locations in Connecticut, and the Hartford healthcare infrastructure is allowing us to do that.
Okay, so how specifically has COVID-19 affected people with MS?
So in general, people with MS are like everybody else in terms of their vulnerabilities. I think that the concerns are, again, with regard to transportation and venturing out. I've noticed, for example, people aren't refilling their prescriptions as often because maybe they don't want to go to the pharmacy. So they're a little more reluctant to travel distances. They're a little more reluctant to travel out. And there are concerns around some of the MS therapies because MS is a disease really of the immune system where it attacks the central nervous system. There's concerns about the effects of some of the medications on the immune system.
So you just talked about that. It's a special concern related to COVID-19 patients being treated for MS might have at this point. What are some of the resources available for further information related to COVID-19 and MS?
Well, I would say the first and most important resource is the healthcare provider. And one of the first things we did when the pandemic broke out is we went through all of the different questions that we thought we might get with regard to therapy and thought about the problems and came up with answers that we could provide to specific individuals. But everyone's situation's a little bit different. It turns out that some of the immunotherapies may actually protect against viral infections, whereas others may create a small vulnerability. We're doing a lot in terms of networking with other centers to collect information about what happens with the different therapies in MS, and hopefully we'll learn quickly.
Okay, fantastic. Well, Dr. Derek Smith, thank you so much for taking some time to share some of that information. We appreciate your time today.
All right, thank you.